Cranial nerve assessment. So, definition. Cranial nerve examination involves a number of steps as you are testing the all 12 all 12 of the nerves in one station. So, rationale. It is used to identify problems with the cranial nerves by physical examination. So equipment, the equipment are hand wash item with distinct odor like lemon peel or orange peel, coffee and vinegar. So cotton ball, pen torch, fundamental scope, fundoscope, tuning fork, neurological reflex hammer, and Snellen chart. Suggested action and rationale. Step number 1. Perform the aseptic techniques before doing any procedures. So, rationale to prevent contamination. Step number 2. Explain to the client the procedure and its purpose. Rationale to reduce anxiety and solicit the client participation. Step number 3. To test the olfactory nerve number 1. Ask the client to occlude each nostril separately and ask the client to close eyes and present familiar odors such as vinegar, coffee, lemon, orange, or ammonia. Rationale to assist the sense of smell. Step number 4. To test the optic nerve number 2. Help the client to cover each eye separately to test the visual acuity using a Snellen chart or newspaper. Rationale to assist the visual acuity. Step number 5. Have the client cover an eye. Examiners move an object from the peripheral towards the client nose from the superior, inferior, medial, and lateral position, while the examiners instructs to fix client gaze straight ahead. So, rationale to assist visual field. Step number 6. To test the oculomotor nerve number 3, trochlear nerve number 4, and abducens nerve number 6. Darken the environment by covering the windows with curtains or decrease lightnings. So, shine a bright lights in the pupil. Ask the client to stare at a near of an far object. Rationale to assist the eye movement, eyelid, pupillary constriction, lens accommodation. Step number 7. Ask the client to follow an object while moving it horizontal, vertical, and oblique direction. Rationale, eye movement, to assist eye movement. Step number 8. To test the trigeminal nerve number 5. Ask the client to open the mouth and to clump jaw tightly together. Observe for jaw symmetry. So, rationale to assist facial expression, corneal reflex, and mastication. Step number 9. Stroke cheeks, head, and jaw with a wisp of cotton, sharp object, cold and warm object, and the vibrating tuning fork. Rationale to assist the facial sensation and corneal reflex. Step number 10. Touch each eye cornea with a wisp of cotton ball. Rationale to assist the cornea reflex. So, step number 11. Tap the chin with the reflex hammer while the client is slightly open the mouth. Step number 12. As to test the facial nerve number 7. So ask the client to wrinkle forehead, smile, frown, raise eyebrow, look at the ceiling and whistle. Rationale to assist facial expression and muscle movement. So step number 13, instruct the client to close the eyelid and resist while the examiner applies effort to open them. So rationale to test facial acuity. Step number 14, apply sweet, sour, salty, and bitter flavor to the both side of anterior tongue. Rationale to assist facial expression, muscle movement, salivation, hearing, and taste. Step number 15, perform to test the vestibular cochlear nerve number 8 and performing the Rhine and Weber test with a use of tuning fork. So rationale to assist hearing acuity. So I'm going to disinfect all my equipment. So first I'll disinfect this. So yan. Then di po nilagay ko po ang towel, white towel. Next po is yung ating pen light. Sunod po ang ating tuning fork. Ang ating pong hammer. I hand soap po, alcohol for samples. And then po ang ating lalagyan po ng cotton ball. Clean. Sunod po ang ating lalagyan po ng trash. Contaminated cotton ball. So, pwede disinfect po natin ang ating kamay. One, perform aspect technique. So, sir, kamay niyo po. So, step number 2, explain to the client the procedure. So, sir, ang gagawin ko po is i-inspect ko po yung paningin nyo, pandinig, pang-amoy, at panglasa po. Tapos po yung facial expression. So, step number 3, perform the nerve, olfactory nerve 1, cranial nerve 1. So, sir, pikit po kayo, sabihin nyo po kung ano yung naamoy nyo, specific po. So, ito po.
Suka.
So, sa kabila po. Ito po.
Kape.
Step number 4, cranial nerve number 2. So, we're going to perform the confrontation visual field. So, sir, ang gusto ko pong gawin nyo is, tingin po kayo, cover niyo po yung isang eye niyo po. Dito po, yan. Tapos po, tingin po kayo yung mata niyo dito. Tapos po, kung may lalagay po ako ditong number, sabihin niyo po kung ano yan. 1, 2, 3, go po.
2. 2.
So, sa kabila po.
2. 2.
So, next po, I'm going to perform the visual acuity. So, sir, tingin po kayo sa Snellen chart po, tapos basahin niyo po kung anong level po ng yung nababasa niyo po. So, cover niyo po muna yung right eye niyo po. Go po.
Level 8. D, E, F, P, O, T, E, C.
Sa kabila po, sir, right eye.
Level 8. D, E, F, P, O, T, E, C.
So, sunod po, sir.
D, E, F, P, O, T, E, C.
So, sir, ngayon po, I'm going to perform your eye muscle. So, sir, tingin po kayo dito. Yan po. 1, 2, 3, go po. Hinahanap ko po dito yung panginig po ng mata. I'm going to perform step number 6. I'm going to inspect the cranial nerve number 3, oculomotor, cranial nerve number 4, trochlear, and number 6 is, cranial nerve number 6 is abducens. So, sir, yun na. So, sir, gusto ko pong tingnan niyo yung pen light po. Tingin po kayo dito. Sundan niyo po kung saan po yung movement. So, I'm going to check for the oculomotor. So, sir, yun po. Titignan po natin kung may mga shaking movement po yung palis niya. So, yan. Ang sunod po is, yung sunod po is yung eye reflex. So, yung pupil reflex. So, sir, tingin po kayo doon. So, okay po. Kabila po. Yan. So, next po, sir, is, gagawin ko po is, tingin po kayo doon sa pintuan po. Tapos po, tingin po kayo dito sa pen light po. So, tingin po. Sundan nyo lang po yun. Number 8, cranial nerve. Number 5, trigeminal. So, sir, I want you to clench your teeth po. So, next is step number 9. So, I'm going to get the hand. Ito po, sir. Naramdaman niyo po. Sabihin niyo po kung naramdaman niyo.
Yes, nararamdaman. 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 Nararamdaman.
Number 10, touch the eye cornea. So, sir, ang gagawin ko po sa'yo is, itatouch ko po yung white ng eye niya po. Tapos po, with this cotton balls with a pinch like that. So, sir, 1, 2, 3, po. kabila po. Open ano po yung eyes po. Okay po. Step number 11 po. Okay. So, sir, open wide po. Little open lang po. 1, 2, 3. This is po for pampalit po sa hammer. Number 11. So, sir, I want you to make face po. So, first po, smile po kayo. Raise your eyebrow. Wink. Look at the ceiling po. Whistle po. Okay. So, next po is step number 12. I want you to close your eyes po, sir. I'm going to attempt open it po. Okay. So, step number 14, for taste. So, sir, may mga ibibigay po akong pagkain. So, pikit po kayo. Sabihin niyo po kung anong lasa po. Ito po. Say up po. Ano po?
Matamis.
Pikit po kayo. Ito po. Say ah. Ano po?
Maalat.
Ito po. Ah po. Lasa po.
Asin.
So, yun na po. Step number 15. Step number 15. Cranial nerve number 8. Vestibulocochlear. So, sir, tayo po kayo, sir. So, tatakpan ko ba yung kabilang tenga nyo, tapos I'm going to whisper po So, dito po.
Apple, banana.
So, sa kabila po.
Pangit niya. Mama mo.
Number 9, I'm going to test for glossopharyngeal and the gag reflex and uvula. So, then, sir, say apo. Ito po, harap po kayo sa akin. Tongue out po. Say Okay. So, sir, iuuro mo po ito sa pinakadulo. Baka po may chance po na masukat po kayo. So, going po. Okay po. So, cranial nerve number 11. Accessory nerve. So, sir, ang gusto ko pong gawin nyo is move your head left, right, and up and down po. So, sir, taas nyo po yung shoulder nyo po, tapos pipigilan ko po, dapat mataas yung game po. Okay po. Cranial nerve number 11. So, hypoglossal nerve. So, sir, gusto ko pong gawin nyo is ilabas niyo po yung dila niyo po, tapos i-move niyo po side to side. So, na-move po niyo, sir, yung dila niya po, so, yung nerve na po yun is intact. Step number 15. Also, step number 15. So, I'm going to perform the Renee test. So, sir, sabihin, may maririnig po kayong bass, tapos po, sabihin niyo po kung saan po mas malakas. Po, position A or position B. So, position A po. Position B. So,
Position A.
okay po. So, sa kabila po. Sir, dyan po. Ano po. So, position A po. Position B. Ano po?
Position A.
Okay po. So, next po, sir, I'm going to perform the Weber test. So, sabihin niyo po kung saan niyo mas naririnig yung sound, sa left ear or right or in middle. So, sir, po, game po.
Middle.
So, thank you po, sir, for being my patient. Tapos na.